And this is where it gets serious because no other type of infection kills more children annually globally than pneumonia. Sorry, I think I have a slight cough. And I know it's one baby that gave me. Babies get cough and they can give you. But that's not the point of this discussion. The point of this discussion is that babies do have cough, and as a matter of fact, children who are in creche are entitled to up to 8 episodes of cough during the year. But how can you tell if this is just a common cold or if it's a more serious chest infection? When it comes to cough in children and babies, a lot of things can cause cough. Anything from the common cold, which is usually caused by virus, to allergies, to even foreign bodies that get stuck in their airways, can give children coughs that can be really nasty. Even asthma can give them coughs that tend to be worse at night. But how can we tell if this cough is just a common cold or if it's a viral chest infection? The common cold usually comes with a runny nose, and that's one thing that can help you to differentiate between a cough that is a chest infection and a cough that is a common cold. The main difference between the common cold and a chest infection is that while both of them might give you cough, there is no fast breathing with the common cold. So if you think your baby is breathing faster than they normally would, then maybe that might be much more than the common cold and you need to give your doctor a call or go straight into the emergency room for them to just have a look and trust your instincts as a mother. If you think your baby is breathing fast, then maybe they are. You might ask me, but Dr. Rena, temperature unko? Temperature. Maybe they used to have temperature when they have chest infection. They actually have fever when they have both the common cold and the chest infection. So fever isn't the best way of differentiating between the common cold and a chest infection. As I said, fast breathing is the best way to know if a child has a chest infection. With the chest infection, they breathe really quickly, but with the common cold, there's no fast breathing. Another thing that can actually help you to differentiate between a chest infection and the common cold is the presence of catarrh. Usually, a runny nose is not present with the chest infection, while with the common cold, they have a runny nose, and I know some of you are going to use your mouth to suck that catarrh out of that nostril. I've said it time and time again, use something else. Find a device that you can use to get that catarrh out. If not, you'll end up getting the same infection that baby has. Why am I making all this noise about a chest infection? And this is where it gets serious because no other type of infection kills more children annually globally than pneumonia. Pneumonia is a type of chest infection. There are other chest infections like bronchiolitis, but let me not bore you with those details. What you need to know is that when it comes to babies that are less than 1 year, it's very easy for them to have complications from chest infections, including low levels of oxygen in their blood. They can have the infection move from the lungs to other parts of their bodies like their brain and even their kidneys. When children have chest infections, there's a tendency for them not to eat or drink adequately, and this can make them dehydrated very quickly. And the last thing we want is a dehydrated child because organs just don't function properly when a child is dehydrated. So a chest infection is not something that we joke about. You might want to ask me, but Dr. Rena, how come? They're always coughing. These babies, these children, they're always coughing. They are more susceptible to having chest infections, and that's because unlike you, that your immune system has seen all the gutter in Lagos, these people, they are coming fresh and their immune systems are still trying to learn how to navigate this our very, very dangerous environments, which is why it's very important that if you as a parent have a cough, you should actually cough into your elbow, make sure that you're washing your hands, wear a face mask around the baby so that those organisms that you have picked up from work, you'll not come and give it to the baby in the house. Another reason why chest infections tend to be particularly more challenging in babies and young children is that their airways, their breathing passages are very narrow. Unlike your breathing passage that is like Lagos Ibadan, their own breathing passages are really tiny, such that whenever any organism or fluid infects their lungs, an airway that was like this before becomes like this very quickly. So it tends to be more dangerous in them. So please, we need to do everything within our power to prevent our kids from having chest infections. What are the signs and symptoms of a chest infection? It really does depend on the age of the baby. For very young babies who might not be able to talk, sometimes they might not even have a cough. Sometimes all they'll have is fast breathing, some difficulty with breathing, and fever. But cough is very common in them. So the point is, don't always assume that since a baby is not coughing, it cannot be a chest infection. Sometimes the only symptom of the chest infection might be a fever and fast breathing. However, most children will cough when they have chest infection. So look out for a cough. They can also have things like poor feeding. They'll stop eating and you notice that they're drinking poorly, they are not eating and they begin to refuse food. Some might actually even vomit. I know all this sounds alarming, but I promise you, once you notice these symptoms and pay attention to them, and I know you will, then you can detect that the child has a chest infection on time and go to the hospital to seek medical attention. I know you like some guidelines to say, okay, Dr. Rena, when should I actually go to the hospital? When should I get worried? Number one, if the coughing has lasted for more than 3 days, go to the hospital. Even if the cough has not lasted for up to 3 days, but you notice any of the following: persistent vomiting such that baby or the child is not keeping anything down. If a child who is less than 1 year is taking less than 50% of their usual food intake or drinking less than 50% of their usual fluid intake, then it means that you have to go to the hospital because they might get dehydrated very quickly. If a child who is less than 1 year has not had a wet diaper in up to 4 hours, that means that they are probably dehydrated and they need to get some kind of fluid into their system, and that's a need for you to go to the hospital. If a fever persists for more than 3 days, you also need to go to the hospital just in case it's something that needs to be treated, because a fever isn't always a chest infection. We need to make sure that it's not anything else like malaria, and so a hospital visit at that point would be very important. I hope with these few points of mine, I've been able to convince you, not to confuse you, that these are some of the reasons why if you think a child has a chest infection, you should go to the hospital and get some treatment. You know me, I'm all about prevention. Prevention, they say, is what better than complete it for me. Exactly, $10,000 for you. But preventing chest infections is all about how you and I go about caring for our children. Number one, immunization. It's so important to actually immunize your children against any of the organisms that can cause chest infections. And keeping up with your child's immunization schedule is absolutely essential. Good nutrition, I cannot tell you how important this is. Making sure that they're exclusively breastfed and making sure that they're getting the best nutrition is going to make their immune system kajad, buga. It's going to buga the viruses that are going to come and try to give them a chest infection. Also, it's really important that hand hygiene and proper cough etiquette is taught to other kids, because kids, so the older kids come from school and he wants to lick the face of his junior brother, but he has a cough, and it's really hard to actually separate them. So you need to teach the older child or even yourself good cough etiquette. Don't cough into your palm. No, didn't COVID teach you anything? Cough into your elbow, because I'm hoping that nobody uses their elbow to rub the handles. Here's how cough actually gets from one person to the other. If you cough into your hand and you actually don't wash your hand and you touch a door handle, that virus that is in your hand is actually on the door handle, and somebody else will touch that door handle and then rub the baby's face. So it's very important that you actually cough into your elbow. Also, hand washing. Good hand hygiene cannot be overemphasized. Wash your hand as frequently as possible to make sure that you're not transmitting the viruses that can cause a chest infection from one person in the home to the other. I hope these points are helpful as far as preventing chest infections in children are concerned. Not all forms of chest infection will require admission into the hospital. Thank God. Okay, for the ones that they actually tell you that you can manage at home, the doctor is going to tell you things like make sure that you're giving extra fluids. Extra fluids, very important. Whether it's water, freshly squeezed orange juice, chicken soup, just things to keep the baby or the child really well hydrated. If there is a fever, paracetamol or ibuprofen, those are your friends. So make sure that your child is as comfortable as possible. And then of course, make sure that they are kept nice and warm. Give them cuddles, give them hugs, play Dr. Rena's videos for them. Just make them as comfortable as possible. And those home measures actually go a long way in making sure that children with chest infections who can be managed at home have a very comfortable stay.